I'm curious. I mean, can you give us your assessment of the cancer treatment resources in the US and our screening capacity? If you had to grade it, what grade would you give our cancer treatment options for women in the United States?
Well, I really I have to would I would maybe give it a B minus right now. Maybe a C plus. It leaves a lot to be desired. I mean, for example, beyond that, we have an affordability problem. If you don't have health insurance, then getting access to affordable mammography is very difficult. The Affordable Care Act makes mammography screenings free, but of course, you have to have the coverage, and we do have gaps in that coverage. I mean, millions of women were able to gain access to it once the Affordable Care Act passed, but we still have many more women that we need to make sure get coverage. But then, for example, if you are at higher risk, one thing I discovered in the last several years, and this actually happened to my own mother, if you have a genetic mutation and you are on Medicare, you can't, if you have a risk of having a genetic mutation like I do, and you're a Medicare patient, Medicare requires you to be diagnosed with breast cancer already before they will cover your screening. Even though I was a BRCA2 mutation carrier and I had had breast cancer, my own mother could not get Medicare to cover a screening to see whether she carried the mutation unless she had been diagnosed with breast cancer. Well, we shouldn't wait till women have breast cancer before we make sure that we can test them for a mutation that puts them at higher risk. We want to know whether they're at higher risk so that they can take steps to prevent themselves from getting breast cancer. So I introduced the Reducing Hereditary Cancer Act with Lisa Murkowski and Senator Ben Cardin and Congressman Fred Upton, bipartisan, bicameral legislation that will say, Medicare, you need to cover genetic screening when a close relative has a genetic mutation, and you need to make sure you cover the prophylactic treatment that a patient may want to seek if they have it. Because it's much better to make sure people don't get breast cancer than it is to have to deal with all the ramifications once they do. It's common sense. I kind of can't believe that Medicare doesn't already cover this.